Then they will tell us what they do, how they do it, and what we should know from their work. So let me welcome first to my right and then to the far right. Introduce yourself, tell people who you are and what you do here.
Okay. Hi guys, my name is Penina Njoroge. I am the head counselor at Fountain of Hope Treatment Center. It's a pleasure to be here today.
Okay.
Hi guys, my name is Celine, counselor here at Fountain of Hope and also in charge of customer care.
So thank you. So today we are with the counselors and we are going generally to talk about what they do and how they do it so that we learn a little more about what happens in rehab. I'm Dr. BMS, as you know, and this is Fountain of Hope, where we deal with BMS, body, mind, and soul. So just to start us off, I would like you to describe what is a typical day like in rehab. When you come in, what would someone expect? How would a normal day be for you as a counselor and for patients who have checked in? Yeah.
Okay. So for a normal day here at Fountain of Hope, we report to work at 8 a.m. and that means you have to prepare for the day because you cannot just walk into sessions without preparation. You need to plan the day, and between 8 and 9, that's when you're planning the day. At 8:50, we go and do what we call room inspection because part of the rehabilitation is behavioral change, and part of the behavior change is taking care of yourselves, taking care of the space that you live in, which play a very big part in our mental health. So between 8:50 to 9, we do the room inspection, and at the end of the week, we actually award the best room as part of reinforcement to this behavior change. And then from 9 to 10, we have what we call a morning meeting or a morning devotion. And this meeting is just supposed to set the mood for the day and also to understand how are the patients, because we left the previous day. We want to understand how their mood, if they have any concerns, if there is something that we need to check on and work on before the day starts. And then from 10 to 11, this is our tea break. And also this time we also have our individual session because these clients are seen by their individual counselor to work on their underlying issue. Between 11 to 12, we have group sessions, and at this particular time, we normally have orientation and step work. From 12 to 1, this is also time allocated for the individual sessions because we normally have a number of clients, so a counselor can have more than one client, and so you can set them between 10 and 11 and 12 and 1. From 1 to 2:30, we have our lunch break, and then from 2:30 to 3:30, we go in for our group sessions in the afternoon, which normally focus on life skill training and psychoeducation, and also to deal with other things, concerning mental health and life itself. And then from 3:30 to 5, this is time for the counselors to do documentation, which is a very important part of the treatment, and also to interact with the clients outside therapeutic sessions. So this particular time you will find us having games, interacting, and also doing our documentation.
Okay.
So that's generally our thing.
So hearing what you're saying, it's quite a comprehensive program, starting from morning and going into the evening with structured activities for clients as a group, as individuals, trying to solve their collective and individual problems. And just to add in, Celine, so this typical day, you also said that you deal with the customer care. So if you inject a bit of that, how would the typical day for the counselor be? And even at the customer care area, dealing with people who are coming in, families, how is it like?
Okay, normally I also come at 8 a.m.
Yeah.
By 8 a.m. I should be at work. So I go to my desk kama kawaida, and I personally, as a customer care desk, I take the inquiries, I take the phone calls from other people who are calling outside Fountain of Hope, and I welcome visitors who want to see their clients, their relatives, or people who just want to know more about Fountain of Hope. Yes.
Okay.
Yeah.
And as a counselor, when you step out of the customer care,
Yes.
do you get involved in other things?
Yeah.
Mhm.
For example, the 12 steps of AA. I have a group whereby I take them through the 12 steps of Alcoholic Anonymous.
Yeah.
And also I have individual clients who I see from maybe between 12 to 1 or 10 to 11 a.m.
Okay.
Yes.
So again, getting from you, the typical day for the counselor also dovetails into what the patients do.
Yes.
You are involving them in sessions as a group, as individuals. You are dealing with families. You are dealing with the inquiries, all in a day's work, as they say. Oh, that is interesting. So then, as you're dealing with these patients and families and inquiries, what are the range of problems that, or issues or thematic areas that come before you for attention on a day-to-day basis? Yeah.
So from family, most family members who walk into Fountain of Hope, they either have a patient who is battling alcohol or substance use. They have issues related with mental health. Either there is a psychotic break, someone is battling depression, or they're schizophrenic, or something that needs counseling. So it all comes down to the mental health wellness of their loved one. Yes.
Okay. So the range of problems then around mental health, from addiction to drugs, other mental stressors, overt mental health problems, all coming in separately or joined up. What would you say, in view of this, stands out as maybe the most common, the most challenging, the most spectacular, if you may say, on a day-to-day basis of these areas that you deal with?
Okay. The thing that stands out, because we are a rehabilitation center, it's that most people have an issue to do with substance abuse, and the most commonly used substance in this case is alcohol, marijuana, and tobacco. Those are the NCATs. Those are the main substances that you will find our clients are using. But once in a while, you also find drugs from the other categories. That's the main actually issue that will bring people here. But apart from drug and substance use, you find these people have what we call underlying issues. And so when now we go deeper at a personal level, you are able to identify these things, because you don't just wake up and become an alcoholic or a drug addict. Some things must be pushing you to that level. So at a personal level, now you get to find out what are these other things that are, making this person to drink or to use substance to such an extent where they need to. Yes.
And so people coming in with this range of problems you have described, just maybe our viewers would be interested to know, how then do you filter, how do you know who has what, and you separate them, or you just deal with them, or these ones have addictions, all of them? How do you go about when they come with the individual problems?
Okay, when a patient come, we don't first take them to group, because this person is a stranger to us, and we cannot treat a stranger. So we sit with this person at a personal level. We have counseling rooms, and this person is taken through by a counselor and a nurse. And we do first what we call assessment, intake and assessment. And we want to understand this patient from why are they coming to our center up until their period of conception. So we want to understand this person deeper, and then we take them through psychological testing. So we test for things like depression, we test their levels of coping with stress, and other psychological tests. The nurses and the doctor also take them through the physical examinations, and you want to know if this person is sick, are they taking any medication, do they have any allergies, because you're going to be staying with this person. This place will be their home for the next about 3 months, so you want to know if they're on any medication so that they can continue to take their medication. And in any case they need a psychiatric review. We bring in the psychiatrist, they are reviewed, and at the end of the day, at the end of like a period of 2 weeks, we have comprehensive information about this patient, and so you are able to understand this person as them, not as a group, as the patient now. So it is a collective thing. It's a teamwork process.
Yes. Quite interesting.
Mm-hmm.
So I can imagine people coming in with a range of problems, but also these people are different. Some are young, some are old. There may be cultural differences. Some are male, some are female, even religious differences. How do you tackle when you have this varied mix of people coming? For example, you are a young person, maybe you get someone who is the age of your father. Do you get such patients who are much older, like they are your father or your big uncle?
I do.
Yeah. So how then do you tackle this varied mix that comes to you?
First of all, I'll say the first challenge is usually when they see maybe an older person sees me. I remember there's one person who asked me, what an counsel quick? How do you know that I don't know?
Yeah.
But now you have to be confident.
Yeah.
You have to be confident in what you do.
Yeah.
You have to prove yourself to them that
Yeah.
you know what you're doing.
Yeah.
You just take them as they are.
Yeah.
Maybe in addition to that,
Yeah.
that's why counseling as a profession is different from guidance and counseling, the normal one that we do in school.
What's the difference?
The training we go through, we are taught about how to deal with this all thing. I remember there was one unit where we did multicultural diversity. You know all these things, you get them through your training, and part of it is just being empathetic and treating each patient with what you call unconditional positive regard. You take them as they are.
Okay.
So the training is quite important.
Yeah.
And like she has said, it is what you bring to the table. You need to be confident in what you're doing as a person. And I remember there was one case we handled a lady who was 52 years old. And at the end of that, the period of counseling, she was like, I didn't know that you guys have as much as knowledge as you do. And I am, she was really happy that she took that step, and she believed in us.
Yeah.
She never told us anything at the start, but she made that comment at the end. So it is about what you have to offer as a counselor. Yes, and training is important. So you have to go to school.
So going to school, that's very important.
Yes.
I was just going to tag on that. That you're saying that counseling is a profession. Rehabilitation is a profession. It's not trial and error, it's a science. And so people out there who are interested to know, and maybe some of them would like to train as counselors. We have many young people who follow Dr. BMS channel, and they may like, what does it take? An aspiring counselor, what should you have? What should you look forward to as you plan to become a counselor and even to work in a rehabilitation center?
First of all, counseling is a calling.
Yeah.
And you have to be passionate about this. And then you have to go through training.
Yeah.
Because we are in school, we're equipped with counseling skills. And you are taught how to handle clients.
Yeah.
And then also you should be very empathetic.
Yeah.
You should not actually be judgmental.
Yeah.
You should take clients as they are.
Yeah.
And then you have to be someone who is compassionate. Someone who accommodates your clients as they are. And then above all, be patient.
So I mean, if someone just comes and tells you something which you see it's just outrightly wrong, it's bad, are you not just gonna tell him, oh, that's rubbish? You know?
You will tell them,
Yeah.
but the language is also important.
Yeah.
Because you're the professional.
Yeah.
So you set those boundaries,
Yeah.
you maintain them,
Yeah.
and you do it in a respectful way.
Yeah.
Yes.
Okay.
Yeah.
So I guess that is where the professionalism comes in. Eh?
Yes. Okay, in your head you might make those comments, but of course you're not going to tell them that.
Okay.
Yeah.
So I guess that is where the professionalism is coming in, so that you can distill the issues and be able to project that positivity and steer these people towards recovery, which is what rehabilitation is all about. I know families are out there watching us, and some of them have got problems with their family members who have addiction problems, behavioral problems, mental health problems. What would you say to families? Some of them, as Dr. BMS, they call me and they say, I have my son who has a problem, but I don't know if this works. What should I do? It's like they doubt the process. It's like they're not sure. What would you tell these families?
Okay, first, that this is, a sickness like any other sickness, just like the way you could have malaria, just the way you could have cancer. And I don't think when we are not feeling well, it is not hard to walk into a hospital. So if mentally and you're not okay, it is okay to ask for help. It is okay to walk into a counseling room. It is okay to visit a rehabilitation center, because that's where you will get the help for that kind of problem. So what I can tell them is that they need first to stop stigmatizing mental health as family members, and also stigmatizing their loved one, and also take that step of asking for help, because it works, but it cannot work if you're not here with us. So you need to come to us and we'll give you the help that we can.
So ultimately, they must take that step and come, and hopefully come to Fountain of Hope. Why Fountain of Hope? I mean, as a counselor, you've been here, probably you've been somewhere else, what makes Fountain of Hope worth talking about as a center?
Okay, what I love personally about Fountain of Hope is that first it has qualified personnel, so you can be assured the people who are attending to you know what they are doing, and the recovery of our patient is the most important part of this program. So every day that is our goal. So it is client focused, and especially, and it is individualized. It is not collective. It's all about this client, the denominator. So that is what I like. And then the other thing is that it is in a serene environment, in the suburb of Sokimau. So it is very serene, and we don't allow our clients to access drugs when they are here.
Yes.
That is something that we really, really look out for, and which I think is very important for recovery, because you cannot recover if you're still using the substance. So it makes a difference.
It's good you brought up that point. I've got people inquiring sometimes, and they ask, wakiwa huko watumia hata kidogo daktari? They don't access drugs, And as we're saying, it's important that if you're in recovery, you are really recovering and not getting back and forth, sliding back and forth. So Fountain of Hope is the place to be, in your opinion. And Dr. BMS channel is a channel to tune in, which brings me to the question I'd like to ask you, my viewer. Have you subscribed to Dr. BMS channel? If you haven't, click that subscribe button and let us create a community where we help each other, we educate each other, and we grow together in the health of our body, mind, and soul. So as we finish our video today, there are people out there who still doubt rehabilitation works. There are those who think when you come to rehabilitation, you're just being talked to, kuongea tu. There are those who think probably it should be religious, they ask, mnawaombea, inakuwa namna gani? What would you say in summary, like encapsulates or summarizes rehabilitation? Is rehabilitation spiritual healing? Is it medical healing? You're going and you're giving a surgery. Mnawadunganga shindano, they ask those questions. Mnaongea tu na wao, is it talking? Is rehabilitation these bits or what is it? In summary.
Okay.
Yeah.
So it entails all the parts that you've highlighted, because first physically they have to be okay.
Yeah.
And most of the time when they're using this substance, they don't take care of their physical health. They don't take care of the medical conditions they have. So first you have to stabilize them physically, but that is for a short period.
Mm.
Then now the other bit is psychological, which is the biggest part of this treatment, because we want, what goes in our mind, sometimes people don't see,
Yeah.
and you cannot tell the effect it has on you as a person. So the biggest part of this treatment is psychological. We add bits of spiritual, not religious, but spiritual healing, which is also very important part of recovery. And yes, the other thing we live to God, and I think people actually judge rehabilitation with the number of relapses that happen.
Yeah.
And if they did, then most of us are failures
Yeah.
in this job.
Yeah.
But this is the reality. It's part of recovery.
Yeah.
Relapse happens.
Yeah.
I don't think anyone is stigmatized if they have high blood pressure and their pressure goes high or low.
Yeah.
Or they have blood sugar and they took a soda and their sugar shot up.
Yeah.
They are not stigmatized. But with rehabilitation, we find there's that stigma because people leave rehab. Sometimes they relapse.
Yeah.
Which is part of the recovery.
Yeah.
So the families need also to understand that it is part of recovery. Sometimes it happens, but you can always pick yourself up, which is very important. Yes.
That's a good positive message for the families, and I'm sure it is encouraging for them to know that even if there's a relapse or a slip along the way, the process of recovery is still continuing, and you may reach that destination. Just the final question I would like you to tell our viewers out there. How do you support these people when they have left rehabilitation? They stay here for how long, and then after they have gone, we forget about them? What happens to them?
So they stay here for like 90 days.
Yeah.
So when they are discharged, we have follow-ups.
Yeah.
They come in as now outpatients. They come for sessions like once per week, so that you can follow up on their progress, the things that they are going through, the challenges. Yeah, so we do follow-ups. We just don't leave them like that.
Okay.
Yeah.
So it's a journey that starts and continues. Like you say, recovery is a lifelong journey.
Exactly.
You remain in recovery for the rest of your life.
Yes.
Thank you for your time. I think it's been great. I've also learned a bit because I'm not a counselor. So each time I talk to you people and the other members of the team, I learn something which enriches me as a Dr. BMS. Thank you. Okay.
You can just tell them to follow us on Instagram at Fountain of Hope _Rehab Center, Facebook Fountain of Hope Treatment Center, and Twitter Fountain of Hope _Center. Thank you very much.
Very well. I think we'll even inscribe that somewhere so that they can read and then they follow us up.
Yes.
Thank you, and I'll call upon you next time for more information to our viewers out there about what goes in.
Thank you so much
Thank
for
you
the
for
Very
opportunity.
good.